Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing very well, Katie. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines through today, November 7th. Any questions or comments are always welcome down below or at any of our social media linked in the description. As a reminder, the CDC is not updating COVID numbers, so we will not be reporting them at this time. Vaccines news this week. Huge efficacy and safety data. Can you break it down for us, Dr. Murphy?
Yeah, CIDREP, which is the University of Minnesota Center for Infectious Diseases Research and Policy, which is kind of acting like a shadow CDC these days, since the CDC is not reporting a lot of things. They published a systematic review of 511 clinical studies that were showing vaccine effectiveness for RSV, respiratory syncytial virus, flu, and COVID. So 511 studies. They analyzed all of them to look at efficacy of the vaccine. This review is published in the New England Journal of Medicine, which is the #1 journal basically in the United States and one of the top ones in the world. Highly, highly respected. So they found that taking them vaccines one at a time, the COVID vaccine was 46 to 50% protective against hospitalization in otherwise healthy adults, 37% effective in immunocompromised individuals. The RSV vaccine was 75 to 80% effective against hospitalization in adults 60 years of older. And in maternal RSV vaccination, 68% effective against infant hospitalization. So this is where you give the vaccine late in the pregnancy in women. They make the antibody protects the child. So you're really protecting the child. So it's 68% effective against infant hospitalization. And this is compared to the drug Beyfortus, which is monoclonal antibody that you give the infant up to almost a year of age or 2 years if they have some underlying medical problem. That's 80 to 85% effective at preventing hospitalizations and ICU admissions. So it's a little bit more effective, but you still get effect from the vaccine to the mother. They both work. Seasonal influenza vaccines show pooled effectiveness of 67% against hospitalization in children and 48% in working aged adults and 42 to 53% in older adults. So these numbers may surprise a lot of people, like, oh, it's only 42% or whatever. Still, that's a lot of people. You're talking about 330 million people in the United States. That has a major public health impact. These vaccines are not perfect, but they prevent a lot of diseases, and the people that get the diseases have usually a much milder course.
Mhm. And this is especially important now as we're starting to see increases in some of these respiratory diseases. Specifically, we're seeing rises in RSV for that young age group. Can you tell us the data?
Yeah, these these infants are really at high risk, and they clog up the ICU beds for kids and hospital beds for kids. And typically, so it's little kids that get it and people over 60. So in an average year, the virus RSV causes 80,000 hospitalizations and about 300 deaths in these children who are under 5 years of age. And just in the last month, reports have come out that the number of emergency room visits for RSV has risen threefold. So it's already starting to go up. And, we're talking about like this is really October. So this is coming early, and this will get worse by the month and really kind of starting to peak in January and February, but it's already going up. So RSV is a problem already.
And something we will keep our eyes on to the greatest extent we can. But the story we've been following for months and months and months now, the measles outbreak here in the US. More cases this week. Can you bring us the latest?
Yeah, so the confirmed cases rose by 33 this week, up to 1,681 cases. 12% of those end up in the hospital. There are still the same 3 reported deaths. So it's 2 to 3 deaths per thousand. So that's exactly what we're seeing right now. All the deaths were among unvaccinated individuals, and almost all the hospitalizations were in unvaccinated people. So there's an outbreak on the border of Arizona and Utah, and they've jumped up to about 158 total cases, which is an increase of 20 from last week. This is the second biggest outbreak that's happened so far. The other was in West Texas, which had actually many more cases. That has over 762 people and 2 of the 3 deaths. So we've got another big pocket picking up right now with measles. The disturbing thing is that while all this is going on and keep getting reported, and and the people we've looked at the cost of this, it's some $40,000 per case, in medical care and everything. The uh, uptake in MMR, which includes the measles vaccine, which had previously been mandated, and we had no measles cases in the year 2000. This has fallen from 90%, which is actually too low to keep measles completely tamped down. It's 93 to 95% is needed, but had 90% is at least close. That has dropped to 82%. Um, and this is really, really tragic because this is a very preventable disease. There is no association with autism with the measles vaccines. That's been studied ad nauseum. But, people are confused, especially with the information coming out of some of the public health leaders, political leaders in this country. So if you want to stay healthy and not get measles, you have to have the vaccine. It's so contagious. It's one of the most contagious infections known to man.
Mhm. And it's a little abstract. We can talk about these cases and what does it really mean to have the measles, even if you're not one of the 12%, which is a high amount that are hospitalized. What does that really look like for you in a daily situation?
Well, if these kids get very sick looking, and so to get into the hospital, you have to be really sick, But these kids are sick; they have to stay out of school. They're ill. There's just if you have children to see them that ill, it's so painful. It's so hard. And especially since it's a preventable disease. So it causes a lot of problems because then the people around those kids, if they're not vaccinated, they're going to get measles too. We'll have adult cases if those people are not vaccinated. Now, many older people are vaccinated because the vaccine rate was over 95% in the year 2000. So many people, especially older people, have had the vaccine. They seem to be doing quite well with it. It holds up for quite a long time. You don't really need periodic boosters or anything like that we know of. So this is just a very unfortunate and preventable situation.
Very unfortunate. And our final story today is also unfortunate, and it is around a listeria outbreak linked to certain foods that has led to some fatalities. Can you tell us about it?
Yeah, we're talking about listeria. It's a bacteria, Listeria monocytogenes. It has been associated with ready-to-eat pasta meals by Nate's Fine Foods, which are sold at Trader Joe's, Kroger, and other major retailers. There have been 27 illnesses reported across 18 different states. 6 of these, or 22%, have died. I mean, this is a serious type of food poisoning. It's particularly serious in pregnant women. If a pregnant woman gets listeria, very often they lose the baby. The baby dies, and they can die. One of these cases was a pregnant woman that did lose the baby. So you have to be very careful with listeria. It also can survive in very cold conditions, so it can survive in a refrigerator. And consumers should discard any of these recalled items and sanitize refrigerators to prevent further infections. Really a very nasty, nasty disease. So that's what's going on out there this week.
Absolutely. And very much highlights the need for these food surveillance systems that we have here in the US. So we don't want funding cuts to those. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, bringing us this slightly updated new quick format of the Ask Dr. Murphy series.
Great. Well, thank you very much, Katie.
And thank you all for joining us this week. We hope to see you back next week. And of course, any questions or comments are welcome down below or at any of our social media linked in the description. Have a great weekend.